The Department of Urology at the Jacobs School of Medicine, University of Buffalo, is a very large department having over 60 faculty members. We have over 110,000 unique patients we see every year, 30,000 new patients every year. What does that do? That results in an incredibly large clinical volume. This gives them an ample opportunity to do research, lots of research. We have so much data because we were one of the first programs in the country to go electronic. We are affiliated strongly with one of the largest private practice groups in the country. We do not compete with this group. In fact, we are intertwined with them. They're a critical part of what makes us so successful. That's frankly our secret sauce. I know of no other situation within this country where the affiliation between the private side is so strongly aligned with the academic mission.
Our team, over the past several years, has expanded in an incredible way under the leadership of Dr. Shevely, such that our department now represents every subspecialty within urology.
We have over 63 providers in our department, including prosthetics, male health, female urology, oncology, and others. And that's very important for patient care because physicians are really working on what they love, and that's their subspecialty.
Chronic pelvic pain is a disease that encompasses patients who come in with a degree of pain lasting at least 3 to 6 months. This can be accompanied by bladder symptoms, bowel symptoms, sexual dysfunction, and for some patients, widespread pain.
Well, I've been suffering from symptoms of interstitial cystitis for about 5 years now, and the symptoms have gotten progressively worse over the years, really with frequent urges to urinate and sharp scraping pain in my bladder and urethra. It varies in intensity, but it never really fully goes away.
I think as urologists, we're very good at treating patients who come in with acute urological issues, including patients who come in with acute pain. When patients come in initially, the assessment is mostly about education. We do try to get a complete full history as well as perform a physical exam for whatever a patient is comfortable with. We spend a lot of time focusing on behavioral modifications such as diet, exercise, working specifically with physical therapy. We have a great team of pelvic floor physical therapists here in the area that really do provide a huge portion of exercises and pain management options for patients. We also try to link our patients up with pain management physicians and teams that may help them with their chronic pain management concerns.
A lot of my pain was urinary issues, frequency. I had a lot of stabbing and burning in the urethra, a lot of stabbing and burning in the vagina.
Our challenge is, as urologists, we don't have great experience treating patients with long-term chronic pain, and that's where collaboration with other departments is very helpful.
And what we know is that as chronic pain persists, behavioral factors kick in and have much stronger impact on what maintains these problems, even beyond what caused them in the first place. So the chronic pain treatments are most effective when they deal with the behavioral factors that keep pain going through behavioral support, patient education, and skills building. EPPIC is a landmark NIH clinical trial. EPPIC stands for Easing Chronic Pelvic Pain Clinical Interventions Program. The goal of EPPIC is to assess the relative therapeutic benefit of different self-management treatments.
It's basically helping patients identify triggers or attitudes or behaviors that aren't very healthy and don't work to help their pain and their quality of life, and then also providing them with ways to prevent or stop that downhill spiral. And so part of the process is identifying, what's the effective ways that maybe are less intensive and potentially can be done, at home.
EPPIC taught me how to study my eating habits and drinking habits to identify and avoid triggers. I learned how inflammation in other parts of my body can make my bladder hurt more. And just articulating what my pain feels like and reading about what other people are suffering helps me feel like I have some control over my condition.
We've been at the forefront of developing behavioral self-management treatments for chronic pain disorders that are not very responsive to standard medical treatments. Our work has informed clinical guidelines internationally. Our team has been responsible for much of the research that supports that.
The symptoms were many, and a lot of them were painful in different areas, a lot of tension, and then that also spilled over into the urinary symptoms. So it had dramatic impact on my day-to-day activities, my social interactions, like I was withdrawing from social interactions. Working with Dr. Lackner in the EPPIC study, they really gave me the opportunity to kind of step back and see that whole picture and that cycle that was happening. I would very highly recommend EPPIC because it's going to give you that agency to self-manage some of those symptoms.
My most troublesome symptoms from pelvic pain was an urgency to use the bathroom, and along with that, a constant burning in my urethra. So it really stopped me very often from doing all of the things that I enjoy doing with my family, in my relationship, with work. I gained about 35 pounds, what seemed like overnight, just because I was not able to do the things that my body was really used to doing because I just never felt well. So through EPPIC, I learned a lot of strategies on how to manage my pelvic pain, one of which that is most beneficial to me is really reframing how I'm thinking about the pain that I'm experiencing, recognizing that it's not permanent, that it's a fleeting period of time. So many things in my world have just changed. I've gotten back into exercising, doing the things that I love with my family, hiking, skiing, so it has been really life-changing for me.
You can't possibly start to treat pelvic pain without having interdepartmental collaboration, both with urology, sexual medicine, behavioral medicine. The important thing is that we're able to collaborate not only here in Buffalo, but with other departments around the country.
Collaboration with other departments as well as nationally is incredibly important to us. I think with our large volume of patient population and clinical expertise, we are ideally suited for this collaboration.